Hello everyone. Today, we're delving into the world of a medication called Prazosin, commonly known by its brand name, Minipress. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Prazosin, often recognized by its brand name Minipress, is an oral medication that belongs to a class of drugs called alpha blockers. Its primary function is to relax and widen the blood vessels, which helps to lower blood pressure. Prazosin has been in use for several decades and was initially approved by the FDA in 1976 for the treatment of high blood pressure, hypertension. In addition to its use for hypertension, Prazosin is sometimes prescribed to manage the symptoms of benign prostatic hyperplasia, BPH, a condition in which the prostate gland enlarges and can lead to urinary problems. Prazosin helps relax the smooth muscles in the prostate and bladder neck, improving urine flow and reducing symptoms such as difficulty urinating. It's important to note that while Prazosin can effectively lower blood pressure and alleviate BPH symptoms, it is not a first-line treatment for certain heart conditions or high blood pressure, and its use should be carefully monitored by a healthcare provider. Warnings: Prazosin comes with its set of precautions. Before starting this medication, inform your healthcare provider if you have any allergies to Prazosin or similar medications. It's essential to discuss your medical history, especially if you have a history of heart problems, liver disease, or kidney disease, as these factors may influence the suitability of Prazosin for your condition. Before taking Prazosin, it's important to inform your healthcare provider if you are pregnant, planning a pregnancy, or breastfeeding. The use of Prazosin during pregnancy or breastfeeding should be carefully considered and monitored by a healthcare professional. Side effects: As with any medication, Prazosin can cause side effects in some individuals. Common side effects may include dizziness, lightheadedness, headache, and drowsiness, especially when you first start taking the medication or when the dose is increased. It's essential to be cautious when operating machinery or performing tasks that require alertness until you know how Prazosin affects you. Prazosin may also lead to low blood pressure, hypotension, which can result in symptoms like fainting, blurred vision, or unusual tiredness. To minimize the risk of experiencing low blood pressure, it's advisable to take your Prazosin dose at bedtime or as directed by your doctor. Interactions: Prazosin may interact with other medications or substances you are taking. It's crucial to inform your healthcare provider about all the medications, supplements, and herbal products you are currently using to avoid potential adverse interactions. This includes disclosing any over-the-counter medications or dietary supplements. Dosage: The correct dosage of Prazosin is essential for its effectiveness and safety. Always follow your doctor's recommendations when taking Prazosin. Your healthcare provider will determine the appropriate dose based on your medical condition and response to the medication. Typically, for the treatment of hypertension, the initial dose of Prazosin is low, and it may be gradually increased under your doctor's supervision. The recommended starting dose for BPH is also low, and it is usually taken at bedtime to minimize the risk of low blood pressure. Never alter your dosage or stop taking Prazosin without consulting your healthcare provider. Avoid: While taking Prazosin, it's essential to be cautious when standing up from a sitting or lying position, especially if you experience dizziness or lightheadedness. Rising slowly can help prevent falls due to low blood pressure. Avoid alcohol consumption while on Prazosin, as alcohol can exacerbate certain side effects, including dizziness and lightheadedness. FAQ: Many people wonder about the age restrictions for Prazosin. Currently, its safety and effectiveness in individuals younger than 18 years old are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing: That concludes our overview of Prazosin. Remember, this information is intended for educational purposes and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns you may have. Thank you for tuning in.